So Knox, I just want to make sure that I have everything that you've talked to me about today. You came to see me today because you've been experiencing low back pain that you rated a 6 out of 10 for the last 6 months. The pain is traveling into your gluteal region on both sides, but more so on the right, and does not extend past your lower gluteal fold. That's where your glutes meet your thigh. And you're concerned that this pain is going to increase if you become active, as well as how this is going to affect your working capability and playing with your son. I understand that this is the first time you've experienced low back pain like this, and it has been ongoing for the last 6 months. Currently, the pain is traveling across your low back, but more so on the right and to the bottom of the gluteal fold, as we mentioned earlier. Your previous imaging revealed no structural abnormalities, and you have a history of hypertension, which is being managed by your PCP with a lisinopril prescription. You mentioned that you've noticed an increase in constipation with all the anxiety you've been experiencing with the low back pain and the increased demand of you at work. You mentioned that the only relief you're getting at this current time is sitting with poor posture and a hunched over position, and when you lay on your back with your knees bent and your feet on the ground. Together we discovered that your neuro tests were all normal, but you did not like it when I bent you to the side and leaned you backwards, and that was very uncomfortable for you. We also found that it was difficult for you to have control during the dead bug movements and the prone hip extension. You're demonstrating an exaggerated anterior pelvic tilt, which is kind of giving you a sway back, and the glute abduction strength is 4 out of 5 on both sides, which means it's not poor, but it is weak. From what we can gather, it appears that your back pain is coming from two things that play off of each other. Instability of the joints in your low back, as well as something called lumbar facet syndrome. In your case, it is chronic, and what you're experiencing at the moment is that chronic inflammation at the zygapophyseal joint. That's where your lumbar facets meet. The instability in your low back could very well be from overcompensation in your lumbar region, and this is why it is more comfortable for you at the moment to lean forward in a slumped posture. All this being said, what you have going on is something that is very manageable once we get you on the right treatment plan, and the pain is something that we can get under control quite quickly. At this time, I'm not seeing any red flags, and therefore I do not feel that it's necessary to expose you to more imaging since you've already had x-rays taken. However, if we get through a trial of conservative care and there's no improvements, we can definitely revisit this option. One of the things that you mentioned was that you have some anxiety about being more active and that causing an increase in pain. I understand that it is also compounded with the anxiety about not being able to play with your little boy for fear of throwing your back out further. I have a little boy, so I understand the immense amount of energy that they have at that age. You told me that you don't get to exercise a lot and that your job has you sitting at a desk for most of the day. I do recommend trying to get out of your desk and walk around the office for 3 to 5 minutes every hour if you can. If it's a possibility, I like to recommend a sit-to-stand desk. I personally found mine during chiropractic school on Amazon for the same reasons. I also have lumbar facet syndrome, and so I deeply empathize with how debilitating the pain can be, and it really drains a lot from you. That leads me to my other recommendation here. In order to be able to be more active with your son, I'd like to recommend you take him to the park or walk in your neighborhood if there's sidewalks in the evenings. It doesn't have to be for very long. Start with 15 minutes every day. Let your body get used to the activity level for about a week or so, and then move to about 30 minutes the following week. Take your son with you, let him ride his bike, or walk as a family together after dinner. This can become something you do as a family in the evening. That's not just bonding time, but also a healthy activity for the family as a whole. And this will not only help you, but it will also instill a healthy lifestyle early on in your son's life. Does this sound like a good plan? And do you have any questions before I move forward with the exercises I'd like you to start with? And is there anything that you feel I haven't touched on or that I missed? Okay, Knox, so for the exercises, what I would like you to do, the first one is going to be the dead bug exercise that we previously performed, but we're going to do it in 2 progressions. So what we'll start out with is laying flat on your back, and you're going to want to make sure that your low back does not touch the ground here. You're going to start with your feet flat on the floor and your hands at your side. What you're going to want to do is tighten your core like you're bringing your pelvic bone up to your belly button, but not letting your back be flat on the floor. So you'll start this progression by bringing your opposing hand and touching your knee. So you'll start with it up here, and you'll bring it down and touch your knee. You'll do this 3 sets of 10 twice a day, and that's 3 sets each side. Once you have good control over this movement, I'm going to want you to move forward to the next progression. Here we're going to start with our hands up and our feet flat. Bring your feet up. Keep your core tight. And you're going to drop your opposing arm and leg. So down and up. Down and up. You're going to do this 3 sets of 10 twice a day as well. So for the next exercise I want you to do is going to be the glute bridge. We're going to start laying on your back with your knees bent about shoulder width apart. You're going to draw that pelvic bone up to your back, up to your belly button, flattening out your back, keeping your core nice and tight. Hands flat on the side next to you. Scoot up so you can see my knees. So you'll start here, feet apart, and you're going to want to lift your glutes up, and then that way you are in a straight line from your shoulders to your knees. And you're going to hold that for a few seconds and then drop back down, like so. Hold it and drop back down. Up and drop back down. And you're going to do this 3 sets of 10 twice a day as well.